Okay, good afternoon, and thank you for joining. So I'm just going to say up front, I can't see myself on the screen, so I hope everything looks good for you all. I believe I'm sharing my screen. Can you just confirm that you're seeing the slides? Okay, in the chat it says looks good, so thank you very much. Yeah, so I'm happy to speak about infection control to stop the spread of hepatitis B and C in healthcare settings. And I know this is an important issue for the National Indian Health Board. In June of 2023, our periodical Morbidity and Mortality Weekly Report published a paper about hepatitis C elimination efforts undertaken by the Cherokee Nation. And over the past 5 years, they were able to identify a little over 1,400 individuals that were infected with hepatitis C. They were able to get 61% of them treated, and of those that were treated, 99% of them were cured. So that is great news in the community setting. So happy to hear that is being undertaken. And now let's think about how that might affect us in healthcare. So we're going to talk about the risk for spreading hepatitis B and C in healthcare settings. Think about some places where it lives, those reservoirs of hepatitis B and C. Infection control actions that every healthcare worker can and should take to stop the spread of hepatitis B and C. And we're going to talk a little bit about exposure events. So I'm going to have you use your chat to respond. I did not set these up as official polls, but just to get started, as a check your knowledge question, what do you think? True or false? Standard precautions can stop the spread of hepatitis B and C in healthcare settings. Go ahead and chat your response in. I see some trues. True with an exclamation point. Thank you. That looks great. I'm not going to pause for too long so that we stay within our time frame. But thank you. I'm seeing all trues to that. So we will review that at the end of the presentation. Let's see. So what is hepatitis? Whenever you see that ITIS ending, that means inflammation. And hepatitis is an inflammation of the liver caused by viruses. There are actually 5 types of hepatitis. There are a type D and E as well. Hepatitis D occurs mostly internationally, and hepatitis E, you can only get that if you've had hepatitis B. So we are going to focus on hepatitis A, B, and C, which are serious public health threats in the United States. And so just a quick review. Hepatitis A is a gut bug. Its reservoir is actually feces. It's called fecal oral, which sounds and is disgusting as a transmission method. Hepatitis A is spread when someone consumes microscopic amounts of the virus. So that sounds, like I said, disgusting, but internationally, it's often transmitted through contaminated water. Can also be transmitted when food handlers don't wash their hands well, and contamination happens. So hepatitis A is mainly prevented through sanitation and vaccination. But and is not really known to be a healthcare bug, or not really one that we're concerned about, overly concerned about in healthcare. We have seen hepatitis A outbreaks in the United States, and we are concerned about them, but we are focusing mainly on bloodborne pathogens today, hepatitis B and C. So how serious are hepatitis B and C? Usually they don't feel very serious when people become infected. The infection can be super mild. People often don't even know that they are infected. So 2 out of 3 people with hepatitis B do not know that they are infected. And 40% of people with hepatitis C do not know that they are infected. Hepatitis B can result in lifelong infections that are contagious. These are often spread through during childbirth. Also, injection safety is very important to stop the spread of hepatitis B. But these lifelong infections with hepatitis are a leading cause of liver cancer. And hepatitis C, while it is a leading cause of liver cancer and cirrhosis, it is curable in more than 95% of cases. So the reservoirs of hepatitis B and C first are blood. So blood, these viruses live in the blood and are spread when the virus enters the body through exposure to infected blood. Hepatitis B, like I've alluded to, is a vaccine preventable disease. Hepatitis C is not vaccine preventable, but it is curable. Hepatitis B, if it becomes a lifelong infection, is not curable. Another important reservoir of hepatitis B and C are medical devices. So we think about devices that are exposed to blood. So diabetic supplies, glucometers, insulin pens, lancets, podiatry supplies, particularly nippers, if they are exposed to blood. And then those injection safety devices, syringes, medication vials, and internal surfaces of IV tubing. It's important to note that. Between 2008 and 2019, there have been 25 outbreaks of hepatitis B in the United States. 183 people became infected, and more than 13,000 people had to be notified to come for testing. There have been 43 outbreaks of hepatitis C. 328 people became infected, and more than 100,000 people were notified to come and be tested for hepatitis C. So we see that that is a lot of people affected, and really probably the tip of the iceberg as far as the number of people who have become infected, because many of those people did not present for testing after they were notified. So what is the pathway for spread? So we did already say that infected blood enters the body, and the pathway really are clinical care tasks that bypass the body's natural defenses. So of course, skin is your largest organ and keeps most bacteria and viruses out. But when you do a finger stick, as you can see in this picture, the healthcare personnel is wearing gloves, so they've got some barrier protection. That finger stick, that droplet of blood goes to the glucometer. Again, they're wearing their gloves. If the glucometer is not appropriately disinfected after care, when that healthcare worker goes on to do the next finger stick, those microscopic viral particles can be transmitted through such a tiny action as performing a finger stick. I want to talk for a second about what is included in standard precautions, and for that, I'm drawing from the CDC's core practices for safe healthcare delivery in all healthcare settings. And so in the core practices, we think about hand hygiene, environmental cleaning and disinfection, injection and medication safety, risk assessment with appropriate use of PPE. We'll talk more about that in a moment. Minimizing potential exposures, and reprocessing of reusable medical devices. And we'll see how all of these things really play into the prevention of hepatitis B and C. Is my screen sharing okay? I have one person in the chat says they don't see any slides.
I see your slide. It's on standard precautions. Can everyone else see? Yes.
Okay, great. Thanks. I just wanted to check. I saw that comment. So let's walk through a couple of scenarios. While changing a blood-soaked bandage, some blood splatters on this healthcare worker's eye protection. Was the healthcare worker exposed to hepatitis B or C? Again, use your chat, yes or no, Y or N. I'll give you just a second to respond to that. Potentially. Some yeses, some nos. So unless the blood splattered up underneath the face shield, this healthcare worker has good protection against hepatitis B and C. In this instance, because PPE was worn, we would say that the healthcare worker was not exposed to hepatitis B or C because the eye protection created a barrier and kept the blood from splashing into this individual's eyes. The mask also is offering protection to the healthcare worker's mucous membranes of the mouth. So this splashing onto PPE would not be considered an exposure to hepatitis B or C. And so that brings us to our first element of standard precautions, which is choosing the appropriate PPE for the activity that you are going to perform. So you would wear gloves whenever contact with blood is anticipated, and a gown, mask, and eye protection if splashing might occur. So PPE is a barrier that protects you from exposure to blood. And let's think about some activities for which you might need PPE. So in this instance, they're changing a blood-soaked dressing. Other activities might be irrigating that wound, anything that could cause blood to splatter or spray. Individuals that work in procedural areas, like the operating room or the cath lab, should have their eyes covered and their mouths protected. If you're going into a room to do wound care and there might be debridement or movement of wound tissue, then you would want to have your eyes and your face covered, as well as wearing a gown and gloves. Second scenario, a nurse keeps a few 10 milliliter saline flushes in their pocket, and they are observed flushing an IV with 5 milliliters of the flush, and then they put the flush back in their pocket. And when they're asked, the nurse responds, I keep a few flushes in my pocket, and I only use, half of it each time I flush a line. So it's needleless. I don't have to discard it, right? Could this spread hepatitis B and or C? Again, I'll let you use your chats. You see, yes. Looks unanimous. Yes, yes, this could spread hepatitis B or C, even though there's no needle involved. We said earlier that internal channels of IV fluids can become contaminated with hepatitis C in particular. Oh, nice point, Corey, especially if the line was used for a blood draw, like taking blood samples from a pip. Absolutely. And in fact, the reference there on the slide, the MMWR article, is to an article in which a saline flush was used this way and did result in 3 cases of hepatitis C that had the same serotype as the nurse that administered the flush. And so that brings us to injection and medication safety, never reusing needles, syringes, IV solutions. Can you keep that syringe for the same patient? No, no, it's very important to throw that syringe away. Only use it one time, one needle, one syringe, one time. And I would say no, such a strong no, because the opportunity to inadvertently use that syringe on a different patient is too high, and the risk is too high. And I just also want to point out that this includes pre-filled syringes and cartridge devices. So the saline flush that we just talked about is sort of an example of a cartridge device. It's not actually a medication, and it was needleless, but there is documented transmission of hepatitis C in that way. And then cartridge devices include things like insulin pens. You cannot change the needle on an insulin pen, or you should not change the needle on an insulin pen and use it on another patient. That is definitely associated with this, can be associated with the spread of hepatitis C. So next scenario. This one also has to do with diabetes. In a skilled nursing facility, glucometers are dedicated to the residents. So each resident has their own glucometer. After they use the glucometer, the nurses and the nursing assistants store them in a drawer in the nurses' station. These are dedicated glucometers, so they don't have instructions on how to be clean. And the nurses and nursing assistants say that they don't need to be disinfected because each resident has their own glucometer. Is that true or false? I see a bunch of false coming in. False is the correct answer. Even though they're dedicated to the residents, storing them in a common drawer could spread hepatitis B and C through cross-contamination of those device surfaces. So again, standard precautions. Thanks, Paul. Paul pointed out it's a point of care device. Reprocessing of reusable medical devices. So anything exposed to blood should be cleaned and disinfected immediately after use. Now, some things, if they're used in wound debridement or podiatric equipment, they should be sterilized. But this type of device in particular does not require sterilization, but it does need to be cleaned and disinfected right after use. It should not be stored in a common storage container, not even in a plastic bag, because the plastic bags also can become contaminated with those due to the contamination on those surfaces. In long-term care, CDC does recommend storing dedicated glucometers in the resident's room so that they don't inadvertently get used among multiple residents. And just as a reminder, alcohol prep pads are designed to be used on skin, not on reusable medical devices. One of the good things about hepatitis B and C is that they're fairly easy to kill with common healthcare disinfectants, but your facility should have EPA registered healthcare disinfectants that kill hepatitis B and C. So next scenario. When emptying red bag biohazardous waste, an environmental services worker is stuck by a long needle that was placed in the sharps disposal container. Was this healthcare worker exposed to hepatitis B or C? I'll let you chat your answers in. I see yes and potentially. Like the word potentially. So yes, this healthcare worker might have been exposed to hepatitis B or C. So I'm happy to see you saying that there's the potential. And we don't know yet until we get into actually responding to that, whether or not this person was exposed. But yes, this definitely involves the potential for exposure. So again, it's injection and medication safety. And one of the things on our injection safety website that I really like is a definition of a safe injection. It doesn't harm the person that received the injection. It doesn't harm the person giving the injection. And in this case, the EVS worker is really a community member. They didn't receive the injection. They didn't give the injection, but they were harmed by it. So a safe injection does not harm the community. It's important to recognize that most needle stick and sharp injuries happen during disposal. So just make sure that those containers are not overfilled. And then if there's a long sharp, say from the insertion of a central line, that should be placed in an appropriate container, like a dedicated biohazard container that's used to carry them from the point where they were used to the place where they will either be discarded or reprocessed if it's that type of kit. And then our last scenario, a health department is notified about 2 patients with acute hepatitis C. They have no behavioral risk factors, but they were both recently seen in the same hospital where they were given pain medication. Could this be healthcare-associated hepatitis C? That's a yes or no again. I see a yes and a no. And you know, this is a tricky question. So yes, this was determined to be healthcare-associated hepatitis C, but I can see why you would say no to that, because it did happen in the emergency department. And usually when we think of healthcare-associated infections, we're thinking of infections that occur a certain amount of time after admission. But these patients were exposed to hepatitis C in the emergency department. I really appreciate the person who put IDK in the chat because this is a super hard type of outbreak to detect. It's really a sign of good interview skills on the public health department that they even identified that these patients had been in the same emergency department. And then to really look at what was happening in that emergency department is a whole nother aspect of the investigation. So in this case investigation, they found that there was a certain nurse that had been accessing the medication dispensing system more frequently than their coworkers. And this nurse admitted to taking narcotics and antihistamines for personal drug use. It's important to note antihistamines. There are many drugs aside from that narcotics that have high street values. And so more than just narcotics were involved in this case. The nurse tested positive for hepatitis C, and 13 patients were found to be positive for the same strain of hepatitis C that matched the nurse. 2,500 people who had been in the emergency department when that nurse was working were notified to be tested. And to be honest, I would have to open the reference to remember how many actually came for testing. But that's a pretty large outbreak and a difficult source to detect. So I want us to remember that we really are living through an opioid epidemic, and diversion does happen in healthcare facilities. Drug diversion is a way that hepatitis C and other bloodborne infections are spread, and it results from infected healthcare personnel contaminating supplies, or sometimes using supplies that have been contaminated by patients and then exposing those patients. So we're going to switch gears a little bit and talk about injuries to healthcare workers. And this is an infographic from Project Firstline, just pointing out that needlestick accidents are very common among healthcare workers and can result in the spread of bloodborne pathogens. If we took away all of the interventions that we have, if we took away safe needles, safer sharps, and hepatitis B immunizations, we would see that hepatitis B could be spread commonly among healthcare personnel. And so really want to review some of those things that protect you from bloodborne pathogens. First and foremost is being immunized against hepatitis B. So a healthcare worker exposure to a bloodborne pathogen is defined as potentially infectious body fluids entering the healthcare worker's body through non-intact skin or mucous membranes. So those are your needle stick injuries, sharp injuries caused by scalpels or other instruments, or splashes and sprays to mucous membranes like the eyes or the mouth. A group of researchers did a national survey. 460 healthcare workers responded. And you can see that more than half of them had had sharp injuries or needle sticks while they were working. 84% of those working in general surgery. Overall, nurses, 71% of them had had a needle stick or a sharp injury. Only half of them reported their injuries. Half to 2/3 reported their injuries. So why did they not report their injury? They didn't report their injuries because they thought the device was low risk. So many times they were, had a needle stick injury while putting sutures in during surgery, and they felt that the suture needle was a lower risk device than a hollow injection needle. They perceived that the patient was at low risk. They thought that the patient didn't have any risk factors, and perhaps they even knew the patient's HIV status. So they didn't report because of that low risk patient. They were concerned about looking incompetent in front of their peers. So there's a stigma associated with having a needle stick or a sharp injury, meaning that you weren't handling them appropriately, which we need to really reduce that stigma. And they found that reporting was not useful. So when it comes to the stigma and the reporting not being found useful, I think those are two areas that we can really address. Every time a needle stick or a sharps injury is reported to an occupational health department, they can collect data about how the safer sharps mechanisms are working. If they've recently changed supplies, they can learn that, oh, this supply has a risk we weren't anticipating, and they can go back to supplies or switch to other supplies that might be more protective for healthcare workers. So it's really important that you always report them. And in a just culture, we recognize that accidents and errors don't happen because people are incompetent. They happen because there are safety factors that we can change. And often they happen to the most experienced people. So when there is something like a safer sharps device that could potentially be changed, reporting of that becomes especially important. It's also important to report because any post-exposure prophylaxis needs to be given quickly after the injury has happened. So after an exposure, it's important to flush the exposed area with water, report the incident to your supervisor or following your facility's protocols. If the source patient is available, it's really important to test the source patient. If they're negative for hepatitis B, hepatitis C, and HIV, then there's no post-exposure prophylaxis needed, and you can know that that blood was not infectious. The source patient is not always identifiable and can't always be tested. In that case, then the healthcare worker needs to follow all the instructions provided by the employee health department, which can include administration of post-exposure prophylaxis. Healthcare workers should be vaccinated against hepatitis B, but it's important to note that hepatitis B vaccine does not provide protection for 100% of individuals. So after your hepatitis B vaccination, your occupational health department should document your response to the vaccine, and you should be aware of whether or not you responded to that vaccine. So you should know, yes or no, I am protected by vaccine, or the vaccine, I am one of those rare individuals for whom the vaccine does not work. If the vaccine did not provide you with protection, then hepatitis B IG needs to be given as soon as possible after an exposure to hepatitis B. So stopping the spread of hepatitis B and C and in healthcare involves recognizing the risk for spread, taking actions to prevent spread. So, taking the time to select the right PPE, taking the time to make sure that glucometers are cleaned, using standard precautions for all patients or residents in the facility, just recognizing the numbers of people who don't know that they're infected, reporting exposures, and then for diversion, if you note suspicious behavior, reporting that as well to your supervisor. So once again, just in summary, do standard precautions, stop the spread of hepatitis B in healthcare settings. You can answer true or false, yes or no, but we'll just check in one more time. I like the yes. When used correctly, standard precautions can stop the spread of hepatitis B and C in healthcare settings, but they really must be used correctly. It requires that you are engaged and thinking about what you are going to do, how you might be exposed, and then taking those actions to make sure that you are not exposed. There's a question in the chat, so that's great. I have a slide here that you'll have all of these links when Dree sends out the slides later. But I will go to the question slide, and please do feel free to enter your questions. What is the recommendation to disinfect multi-patient use glucometers? So some glucometers are designed for multi-patient use. If they are designed for multi-patient use, then the manufacturer should provide instructions on how to disinfect them. And that usually involves using an EPA registered healthcare disinfectant, usually a wipe. So usually a healthcare registered disinfectant wipe is going to be larger than an alcohol prep pad. And that disinfectant should have a kill claim against hepatitis B and C. What is the recommendation on checking titers, yearly or just on higher? So usually they're checked on higher, your hepatitis B titers, so your vaccine titers. And then, to be honest, I will have to communicate that. I haven't looked at that standard in a very long time, and I can follow up on that with Adriana. I really believe it's just on higher, but I want to double check and make sure I'm giving you the right answer. Thank you for asking. Are there some scenarios that you've seen when you think that someone could have been at risk for spreading hepatitis B or C? Just as you think about, and I'm not asking you to, I don't want to ask you to, divulge anything. I just, thinking along the lines of risk recognition, are there things you've seen that you think might place people at risk for hepatitis B or C? I don't see any more questions or comments. So Adriana, I will hand it back to you. Hi. Oh, those are nice updates.
Do we have any additional questions for Janet? If not, you know, I love this part of the session. That's use those emojis to say thank you to Janet and give her a round of applause for taking the time, for sharing her expertise. I love the fact that she was very interactive, and I appreciate all of your participation, you awesome participants, for how you all was engaging in the chat and also asking the questions. All of this is why we do these type of webinars. We don't need the whole hour, even if it's just like a little coffee hour, 15, 20 minutes. NIHB, CDC want to make sure we're providing the information that you need to make sure that your staff, your patients, your family, your friends are all safe. So I have included the upcoming announcements. Our next webinar will be August the 9th. And we're going to be talking about the immune system and infectious disease and why that is important. And also our boot camp, this registration for our tribal infection control boot camp is open. I put that link in the box. The boot camp is September the 19th through the 21st. In Vancouver, Washington. Travel scholarships are available. Please make sure you get all the appropriate internal approvals before applying for the scholarship, okay? Okay, and then also save the date. So the Infectious Disease Institute will be September the 11th and the 12th. That is a Monday and Tuesday. Travel scholarships will be available. If you apply for a travel scholarship, you will be asked to travel on a Sunday, just putting that out there. And if you have any additional questions, the registration for the Infectious Disease Institute will open on Monday. The registration for the boot camp is already out there, and the webinar information will be sent tomorrow when I send out Janet's slides of this recording. So if you have any additional questions, please do not hesitate to reach out to me via email. And again, thank you all for joining us today. Thank you. Bye-bye.